Coming up on the Doctor's Hospital podcast.
So you're telling me that we're getting closer to a time where heart surgery, which television and media has always shown us has been, people cracking open the chest and diving in, can be done in a minimally invasive way? That's amazing.
At Doctor's Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off lab, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctor's Hospital, trusted and best care now.
Welcome to the Doctor's Hospital podcast. We are continuing our conversation about heart health with cardiothoracic surgeon Dr. Ramon James. I'd like to welcome you to the show, Dr. James. I know this is a first for you.
Yes, it is. It is. Thank you for having me.
Yeah, we're happy to have you on. I know as a surgeon, I imagine your schedule is very busy, so we're happy to have you on to talk a little bit about your experience, kind of going through the process of becoming a surgeon, especially a subspecialist in cardiothoracics, but as well as talking about some tips, some ideas you can give our listeners about how to manage and maintain their health, and how to avoid, necessarily ending up on your table. So, I love to kind of get background and get a bit of a better understanding, because people take such interesting journeys through healthcare, and obviously when you go into surgery and subspecialty surgery, that is quite a chunk of time from beginning to end. But can you tell us a little bit about, your personal journey, and what may have inspired you to become a cardiothoracic surgeon in the first place?
Sure. So it started from early days in my childhood. I definitely had an interest for the sciences, more biology than chemistry and physics. I was fascinated by the body, not only the human body, but by nature, animals. And that continued throughout childhood and going into high school. Once I completed high school, because I focused most of my time on the sciences, naturally that's what I was good at.
Right.
And once I had finished high school at St. Augustine's College, that is when I was now looking for the next step forward, undecided as to the area of the medical field that I'd be interested in. And there was a program at Doctor's Hospital, the STEP program as well as the TEMS program, which was geared towards exposing the individual to the various specialties. And it was at that time that I realized that medicine was something that I'd want to do.
Did you have a mentor through this process? Was there anybody in particular that you kind of looked up to, guided you through?
Not at that time, no.
Okay.
No.
So what ultimately led you into, because obviously you said you had an interest in science.
Right.
You obviously became good at it because you had an interest. You spent a lot of time in it. How did you go for, because you had the interest in medicine. So how did it go from medicine then into specifically surgery and cardiothoracic surgery?
So once I entered medical school, I enjoyed doing things with my hands. And when I started a surgical clerkship in my 3rd year and rotating through general surgery at the time, I was again fascinated by now applying anatomy and the understanding of the body to real life.
The practical space.
Right. And surgery actually gave the opportunity to drastically make a difference in someone's life. It wasn't until the 4th year at the University Hospital of the West Indies in Jamaica, there was a visiting cardiothoracic team from the United States collaborating with local surgeons, providing intense cardiac procedures over a 5-day period. And that was my first introduction to cardiac surgery. Standing in the room in the corner, looking at the monitor on the screen, really being mesmerized by the fact that people were effortlessly operating on the beating heart, stopping the heart, restarting the heart. And then the following day, actually seeing these patients being wide awake and in a couple of days leaving the hospital.
Right.
And at that point, I said, this is something that I definitely would like to do.
So it sounds like an amazing thing to see.
Yes.
Hopefully we get to do some behind the scenes and see some of that ourselves.
Right.
So obviously you mentioned two things, and shameless plug, our STEP program has seen a lot of people pass through it who have come back into the halls of Doctors Hospital as physicians, as surgeons, in all kinds of different ways. So shout out to that program.
Definitely.
Another success story. We love to hear them.
Yes.
And then similarly, I think I find it very, very interesting and amazing how opportunities like that, when they come along, to have a visiting team come in and offering that particular experience, it can be life-changing for those who are coming up in the field.
Right.
And so it's always encouraging to hear that, and seeing how that helps to shape and mold our current and future physicians.
Right.
So as we're focusing on Heart Health Month, it is February, from a surgical perspective, obviously, your viewpoint of it might be a little bit different from, like, we were talking to Dr. Mesples from the medical side of it. But from the surgical side of it, why is it important for individuals to be aware of their heart health? And then what role do you play in promoting heart health?
Yeah. So it's very important that we as a people understand the significance of heart health. It is well known, particularly in the Western side of the world, that heart disease is the number one cause of death. Not only with our neighboring counterparts in the United States, but also here locally. When we look on our local data, we can clearly see that there is an increased risk of obesity, as well as an increased risk of heart disease. And it is the number one killer in our setting.
Right.
And this is followed by stroke. And then thirdly, heart disease as a result of hypertension.
Right.
So hypertensive heart disease. So it's very important for us to make the general public aware.
Right.
And through awareness and education, we can actually treat the problem.
So what are I guess some tips, or what are some, because I guess you mentioned a few of the risk factors, but what are some what is some advice that you would give an average Joe, like let's say even for me, to promote better heart health, to take better care of my heart? Obviously, I'm someone who's approaching 40 this year, and you start to kind of think about life and things a little bit different. Right. So, looking at somebody like me, young professional, family, in pursuit of career, all of that, what kind of advice, tips would you give to someone like me to say, here's how you protect your heart health and you try to keep it healthy?
Right. So it's never too late to start. Prevention is better than cure. We know that 90% of heart disease can be prevented by simple lifestyle modifications.
Right.
And these are things like diet, low salt, low fat diet, staying away from processed meats, increase consumption of fruits and vegetables. It's very easy based on the fast pace of life for us to eat a lot of fast food, as well as to live a sedentary lifestyle. So exercise, and the time has shown that just get moving 3 times a week, 3 to 4 times a week, up to 30 to 40 minutes, just to get the heart going, will definitely translate into better heart health. And there are other things such as smoking, stay away from smoking, right. Increase alcohol consumption, and to treat those diseases that put patients at risk. The common ones, hypertension, high blood pressure, as well as diabetes, right. And high cholesterol.
Right, which I imagine is a part of the challenge and the difficulty here, is that we have so many comorbidities when you're looking at heart disease. I guess in a lot of instances, like you said, it's tied to hypertension or diabetes and these other issues that we already know that we're at high risk for and we have a high incidence rate of. So maintaining your general overall health would kind of be the starting point.
Yes.
So I'm always intrigued by when we look at certain areas of illness and disease where there's a surgical and a medical component, and kind of the relationship and the interaction between the two. So, can you kind of explain I mean, obviously, we know, generally speaking, the idea is the surgeon's cut, right? But can you kind of explain the fundamental difference between like the medical and surgical approach to heart health and treating a heart illness? And what does it look like, that kind of relationship between the two if you're working in tandem to treat a patient?
Right. So the important thing to highlight is that in the treatment of heart disease is really a collaboration between the various entities, the primary care physician as well as the cardiologist, who deal primarily with the medical aspect of heart disease.
Right.
And then the surgeon, the cardiac surgeon, who then deals with the surgical aspect. And we know that the theme that is being echoed throughout the world is that the heart team, where there's a group with the same interests, common interests of achieving the best patient outcomes.
Right.
So the medical aspect really looks at diet modification, as mentioned before, lifestyle modification, and to some extent medications on a whole to treat those comorbidities such as hypertension and diabetes. Unfortunately, two things can occur. Patients can continue to have disease progression despite medical treatment, or they may come in with in extremis, for example, with a heart attack, and require urgent intervention.
Right.
That is where the interventional cardiologist as well as the cardiac surgeon comes into play. The interventions provided by the cardiologist for the more common heart condition is coronary artery disease, where there's blockage of the vessels that supply blood to the heart muscle. There's the option of stenting, which a stent is deployed within the vessel that opens the vessel and allows blood downstream to the heart muscle.
Right.
But there are some cases where the stents are not able to fit into those tight areas. And that is where the cardiac surgeon comes into play.
Right. Dr. Masples told us a little bit about that stenting process. It's amazing the things that medicine and treatment has come to over time, to where you can kind of put something into a vessel in someone's body, in their heart, and expand it and allow the blood to flow through in a way that it wasn't able to. It's just, it's a truly amazing thing to kind of ponder, just the inner workings of our body and how we go about treating it.
Definitely.
So you kind of already touched on a little bit how you would end up in a space where you would end up needing one particular intervention methodology versus the other in terms of medical versus surgical. So we kind of talked about that a little bit. Surgery is another space where I imagine technology has a great impact on how you're able to conduct surgery on patients. So I know, obviously the rage would be anything where you can do minimally invasive. I'm not sure if that's a space, if the heart is a space where that's even a possibility. But
actually it is. So two of the more common procedures performed by the heart surgeon, coronary artery bypass grafting, which is where we use a graft, commonly from the leg, length of vein, as well as the artery from behind the breastbone here. And we bypass the blockage with that graft, allowing more blood from upstream to go downstream. And by doing that, increase the blood flow, oxygen, and nutrients to the heart muscle. This is a standard procedure that has been done for decades. But now we're doing it in small incisions, and in some parts of the world, there's no a lean towards minimally invasive coronary artery bypass grafting with the robot, etc. It still hasn't gained a lot of traction, but it really shows you how bright the future of cardiac surgery is.
Yeah, I mean, I think, obviously the thing that people talk about a lot, and like I said, it's interesting to hear it in the heart space, but when people talk about surgery, the idea typically is, how soon can I get back to my normal life, in terms of getting back to work, getting back to your family, whatever that looks like for you. So obviously that sort of technological advancement and bringing that into cardiac surgery is really cool to hear. So yeah, like I said, minimally, you work in surgery, so you know better than I do. But that idea of moving to minimally invasive where it's possible has definitely been a shift for quite some time now in a lot of other spaces. So it's interesting to hear it kind of now, developing maybe a little bit of a foothold in the cardiac space as well. Because like I said, it's a space where people want to be able to get back to life as quickly as possible.
That's true. And what you find a lot of times when patients come to the office, we have to think of the holistic aspect of medicine, in that there's a lot of anxiety around the condition, as well as the need for surgery, because the patient sees it as major surgery. You're opening the chest, you're going to put them on the heart-lung machine, you're going to stop the heart, restart the heart. And as you can imagine, for anyone, even for myself, if I was to undergo cardiac surgery, there would be a lot of anxiety around the procedure. And it's important for us to relate to the patient. The common questions you'll find is, how soon would I be able to return to work? When would I be able to start driving? How soon would I be able to go back to my regular activities? Right. These are common questions. And sometimes patients are the breadwinners, sole providers for their family. And as you can understand, that would be a significant burden if there's a prolonged recovery after.
Okay. Yeah. I want to circle back a little bit to the conversation on the interplay between surgical and medical. How critical is it for holistic patient care that there is a multidisciplinary approach to care, particularly as it comes to heart health?
Right. So we know that once we have a multidisciplinary approach, patient outcomes are significantly improved.
Right.
I always think of it mind, body, and soul. The body, yes, we look on the medical aspect, but as we mentioned, lifestyle modification with change in diet, etc., is important. And this plays the role for the nutritionist, the dietitian, as well as a physiotherapist for cardiac rehab post surgery. And more importantly, we can't underestimate the importance of a support group. That is not only as family, sometimes it's close friends, but these are the things that make the difference. And by counseling the patient before surgery, once their mindset is changed and geared, they have an optimistic outlook, we find that patients after surgery do much better. Yeah. So this is combining all areas, not just the medical aspect, but the other areas to improve outcome.
And we've seen that. So obviously one of the spaces that operates like that here in Doctors Hospital is our weight loss team, right? And so they're a multidisciplinary team. You have a surgeon, you have a nutritionist, you have psychologist, psychiatrist, you have an internist, and you have a full dynamic suite of individuals. And then also they lean on rehab from the physical therapy side of it in terms of exercise options and things like that. You also mentioned the idea of support group, another similar thing that we have with our stroke support group that we just started. It's interesting. I think when you look back through the pandemic, I think you have to consider some of the patient outcomes that we saw was somewhat influenced by the lack of that ability to have that support and that connection the same way, right? So you have a lot of different support groups that existed, and where people were having limited contact with people who weren't in their household. One can imagine just how much that affected and impacted people's ability to go through any sort of health issue, whether it was COVID related or not, and then come out on the other side. Because I don't think you can underestimate the value of that psychological and emotional support when someone is facing what could be a life-threatening illness or health situation.
Right.
So speaking of that, I mean, obviously, anybody who watches any sort of medical programming on TV, when you hear and when they present the word heart surgery, you have this idea of people ripping the chest open and all these sorts of things. But as you talk through patients, or as you talk patients through prepping for surgery and that sort of thing, how do you kind of navigate that discussion around potential risks, and ensuring that patients are well informed as they go through the process? Because I imagine, if I'm going into heart surgery, there's a certain level of concern, like, am I going to come out on the other side? And that has nothing to do with the surgeon or the location or anything like that. It's heart surgery, right? Right. So how do you kind of navigate that? Because I imagine your patients a lot of times would be very high stress.
Yes, definitely. So it goes back to the fundamentals. It's very important when you're seeing the patient for the first time that you find out a little bit from them what their expectations are, their desires, as well as the family, and the major concerns that they have, and address them individually. Sometimes this may require more than one visit. And then we'll go through the procedure, discuss the risk associated with the procedure, but also the benefits and the alternatives that for the condition. It's important for them as much as possible to be able to speak with individuals who have traveled that road before. That really addresses a lot of the concerns, and for them to actually see it in a living proof that this is possible. And to meet the other members of the staff, the anesthetists who will put them to sleep, the physiotherapists, etc., and to give them a step-by-step structured approach to surgery after. What we find is that when you tell a patient what to expect, once they leave the operating theater, you tell them you're going to hear a lot of noises, you're going to hear the ventilator, but I will be there. You will hear my voice. I'll ask you to hold my hand. You will find that when they get to the recovery room and they hear your voice, that makes a difference. That connection which was established before actually taking the patient to the operating theater. So it's really walking side by side before it all begins and straight to the end.
Yeah, because I guess you kind of give the person, like, this is your marker that you've come out on the other side. So when they feel that touch, when they hear the voice, it's like, okay, I know I've made it through.
That's right. Yeah. And heart surgery has evolved a lot over the years. We're fortunate now, based on all of the trials over the years. The risk with heart surgery was much higher many years ago. Now, for a routine cardiac procedure, you're looking at about a 98% success rate.
Wow.
So there's still a risk,
right?
But the risk has come down quite significantly. And when we look on the risk to benefit ratio, we know that the benefits far outweigh the risk.
Right.
Yeah.
Okay. You mentioned a couple of times as you've gone through this thus far, you've kind of touched on rehab a little bit, but how critical is rehab a component of this entire process?
It's initiation of rehab and patients sticking with rehab is what translates into improved outcomes after surgery. And one of the critical points is the surgeon as well as the family to make that process easier. It is a very well needed part of cardiac surgery. The work doesn't start until after surgery,
Right.
and that includes physiotherapy, rehab. But we also know that patients who start rehabilitation within the first 30 days after surgery are more likely to complete their rehabilitation. And there's also a decrease in the chances of death, the chances of recurrence, chance of recurrence, as well as chances in improve well-being overall,
Right.
and repeat hospitalization. So that shows you where is very integral in the overall management of these patients.
Yeah. So you're not just sending people out into the void. If they actually take to the rehab process, it's very beneficial to the overall outcome, based on their surgical intervention.
Definitely.
All right. Yeah, this has been a very good conversation. I think I want to end with, just kind of looking into the future a little bit. You already touched on, the idea of perhaps there being a growing interest in moving into minimally invasive in this space. But what other trends do you foresee? Is there anything else interesting in the technological landscape or the approach to surgical intervention for heart disease that you see or that you're interested in? Just as we kind of wrap up.
So there are a number of things. I think really from an interventional cardiologist point of view, we're finding that yes, stenting has always been an option, but we are now looking as a heart team into actually replacement of heart valves to minimally invasive approaches. This is being done worldwide in some high volume centers. And what we find is with good patient selection, patients can return home within 24 hours following the procedure.
Oh, wow.
This is done through small incisions in the groin, and we go up through the blood vessels and deploy that valve where the pre-existing valve is. It is not suited for all patients,
Right.
but we find that, for example, if we have an older patient who may not be the best surgical candidate, who is very high risk, will not tolerate the stresses of surgery, that this would be a good option for them. I don't see it as the cardiac surgeon not being around for time to come, because we know that the replacement of the heart valve through standard open heart surgery still remains the mainstay of treatment for the majority of patients. But it's really the heart team coming together, and the data is there to show that there have been great leaps in success rates and patient outcomes overall. Yeah.
Like you said, I guess, when you talk about comorbidities and things like that, all of that kind of comes into that concept of patient selection. And I know that might sound a little strange to our listeners or our audience, but obviously, as the heart team looks at a potential patient and what the potential intervention looks like, there are a lot of things that you have to consider.
Definitely.
And there's a lot of risks that you have to consider when you're looking at the potential of putting someone under the knife. So I imagine it's the same idea.
Right.
Not everyone is going to be well suited to that particular type of procedure, like you mentioned.
Right.
But it's interesting to hear this idea of potentially moving into that space, and hopefully that's something that we can look at bringing into our environment, as we kind of expand our thought process and our approach to doing heart care and particularly heart surgery here.
Right.
So I want to thank you, Dr. James. Schoolie now, I have to call you. I want to thank you for joining the Doctors Hospital podcast. It's been a very interesting conversation. Yes. And hopefully our listeners and our viewers have the same feeling. But thank you for taking time out of your busy schedule to come and sit with us and talk for a little bit. And we encourage everyone who is watching and listening. It is Heart Health Month. Doctors Hospital does offer discounts for self-pay patients who are interested in having a calcium scoring test done or the CT coronary angiogram, so that you can kind of get an idea of how your heart is doing. and see if you are in need of intervention, whether it be medical or surgical. So we encourage you to check with your primary care physician, find out if it's something that you are in need of, and take advantage of those discounts. It's 50% off both the CT coronary angiogram and the calcium scoring test, all during the month of February. Thank you again, Dr. James.
Thank you for having me.